Thanks, Sophie. Okay, hi everybody. Thanks for the intro, Sophie. So, yeah, Sophie said my name's Megan. I'm the PPI lead for the RDS South Central. I've just got 20 minutes today to go over public involvement in research for social care applications. So I'm going to start by giving a little bit of a background and then talk more specifically about what you'll need to consider when putting together your application. Just for the purposes of this presentation, I'm going to try to refer to it as public involvement throughout, but I do mean sort of service user involvement and carer involvement, patient involvement as well underneath that kind of umbrella term. Okay, so just to sort of start to contextualize public involvement, I think it's helpful to think about public involvement as a principle and not as a research methodology. Moreover, it's a way of working that encourages collaboration. In an official capacity, it's been a requirement of NIHR for kind of well over 10 years, and it has been around in an unofficial capacity much longer than that. It's kind of now widely considered the norm in high quality health and social care research, although you may be familiar with it through using different terminology in different fields. So, for example, we see the use of the word public participation or community collaboration and things like that in different fields. When we think about what we mean by public involvement, I find it useful to reflect on the terminology used within NIHR to describe the sort of different ways in which the public interact with the research community. This is particularly relevant, I think, because again, different fields may use slightly different terminology to describe the same sorts of activity. So it's helpful to kind of look at it within the kind of NIHR context. So within NIHR, we talk about participation, and this is probably the sort of the main thing, certainly, the public think about, and this is where public members are recruited onto study as research participants. We also talk about engagement. This is used to describe the sort of sharing of knowledge or information with the public, perhaps through news reports or outreach work or something like that. The key with engagement is that the role of the public members is quite a passive one, and they're sort of receiving information. And then involvement, which is what we're going to be focusing on today. So involvement is really about the active partnership between research teams and the public. Public members are involved as equals in decision-making processes within the research. So there's a widely used definition which comes from Involve, an organisation funded by NIHR. And this definition is research that is carried out with or by the public rather than to, about, or for them. Okay, so I'm going to talk a little bit now about why public involvement is important. And probably the fundamental reason for involving the public in the research process comes down to this idea of democratic principles, and that it's the sort of the right thing to do. Particularly when we're using publicly funded money to carry out research, it's really important that it goes through a process of scrutiny. It's really key that research is done for the benefit of communities and not purely as an academic exercise, and having the public on board can help ensure that what we research is a priority to communities and will have some sort of longer term benefit. It also helps empower communities and can become a route to influencing change, which is really important. On a more practical level, and certainly what you want to be thinking about when you're developing an application, it improves the health and social care research that we do. So by providing a different perspective, public involvement can help you look at the research question you're posing from a different angle. It can help make sure you're addressing a question that is relevant to service users and that the outcome measures that you're using are the right ones to capture that kind of meaningful difference. It can give you an on-the-ground perspective that helps to ensure your research is sort of manageable and practical for potential participants further down the line, that what you're asking is appropriate of them in terms of kind of, you know, acceptability and things like that. So this insight into kind of potential barriers and concerns of potential participants is hugely valuable, and studies have shown that research that involves patients in the decision-making process around recruitment, for example, are more likely to reach recruitment targets. Lastly, I think there's a really important role in terms of the idea of demystifying research and promoting a kind of two-way learning process between the research community and the public. I guess this links back to my earlier point about kind of transparency, but it's important from the perspective of helping to promote a kind of sense of ownership in the public for research. We see a lot, particularly at the moment, that the damage movements like the anti-vax movement can have. And I think it's really important to remember that we as a research community have to do all we can to make sure that we have buy-in from the public and that we're bringing the public along with us. Okay, so I really apologise for the very, very small slide here. There is a link available there where you can access this, this diagram later if you want to see it a bit bigger. Essentially, this is a depiction of the research cycle. So this is something that we developed at the RDS. It's split here into 8 sections, and under each one are suggestions for the kind of public involvement you might want to consider at each stage of the research cycle. It's worth noting here that it's really important to recognise that every single research project is going to be different and none of these suggestions are universal. So you're going to need to consider really carefully what would be meaningful and valuable as a role for public members for your specific research project. But as a sort of tool to help you think about the possibilities and some of the options, this can be really, really helpful. So I'm just going to go into a couple of the sections of the that particular research cycle in a bit more detail. So this one here, the design. So your focus at the moment will almost certainly be on this particular area of the research cycle, so the design side of things. As I kind of reflected on earlier, there's a number of ways in which the public can provide meaningful input at this stage. Again, it will be different based on different projects, but it can include things like helping to clarify the research question, ensuring the methods used are appropriate, assisting on a recruitment strategy, reviewing and commenting on proposed data collection methods or questionnaires. So with questionnaires, should you not be using a validated questionnaire, your public involvement representatives might help you consider the content of that, for example. You'll also want to be thinking at the moment forward to your ongoing plans for public involvement. So that's throughout the kind of research process and your research plan, and including plans for this within your application. So thinking about some of the ways in which public involvement could continue to support your project is really important. This could include a wide range of things. So just some of the kind of common examples that we see are things like a public member representing the patient group on a TMG, certainly assisting with the development of any patient-facing documents or materials such as patient information sheets or consent forms. If a project included an intervention development, for example, the researcher may seek advice and input from public members throughout that process. Public members might help you by providing a different perspective when it comes to looking at interpreting some of your data, particularly perhaps if you're using some qualitative methods. They can also help you think of kind of plan and think about and deliver a dissemination strategy to make sure that you're kind of reaching a public audience with your dissemination as well as an academic one. Okay, so I'm going to have a little look a little bit more closely now at the application form and the expectations. So at stage 1, you'll see there's no specific box for you to discuss public involvement. There is a reference to PPI in the plain English summary, so you'll need to include a small but brief overview here. But although there is no specific box for public involvement, it doesn't mean that you shouldn't talk about it, and the panel will expect to see it embedded within the application. If you take a closer look at the guidance notes, you will see that actually within the research plan, there is the research plan section of the application, there is a description of what is expected to be included in relation to public involvement here. So the guidance note says, the NIHR expects appropriate and relevant involvement of care users, carers, the public and other key stakeholders in the research it supports. It is essential to set out your plans to involve care users, carers and the public in the stage 1 application. Your patient and public involvement plans will be assessed by the funding committee, including patient and public members. There's a link to some resources by Involve, and then it says in this section it is important that you identify all stakeholders who are relevant to your research proposal. For each stakeholder group, you need to be clear about the benefit from your research and, where appropriate, how they have been involved in the development of the application, as well as plans for their involvement in the proposed research. Just a side note there, the Involve website's actually in the process of being moved over to a new organisation called the Centre of Engagement and Dissemination. So it may be that some of the resources linked in the guidance notes are temporarily unavailable. If you can't find anything that you're looking for, I would suggest just contacting some of us at the RDS. We should have them on file, or we should be able to access them for you. So in the second stage of the application process, you'll be expected to go into much more detail, and you will actually have a dedicated section to explain the public involvement work that you've done and your ongoing plans here. The guidance notes in second stage state that your description of how service users, carers and the public have been involved in developing this proposal and how they will be involved in the proposed research should be captured in 3 specific patient and public involvement questions asked elsewhere in the application form. Although you're encouraged to include information about PPI activities within the detailed research plan section, there is no requirement to repeat or duplicate the responses in the 3 specific questions. In rare cases where proposals do not involve service users, carers or the public, clear justification must be provided. Essentially here, it's saying kind of continuing to include information about your public involvement throughout the sort of research plan and the application is valuable, as it sort of helps to it helps the public involvement work to feel integrated into the project, but certainly you don't need to repeat any information that you're including in your standalone public involvement sections. So the actual questions that you will be asked in the second stage are, please describe how service users, carers and the public have been involved in the development of this proposal. At this point, you'll really want to focus on explaining who your public representatives are, any input that they've had in helping shape the application to this point. It's a real strength if you're able to go to give examples of feedback that has been given by your public involvement representatives, and then examples of the changes that you've made as a result of those feedbacks to really sort of show the influence and the impact of that input from your public involvement representatives. In terms of how the RDS can help at this stage, so we can work with you to think about your research project, how you might benefit from meaningful public involvement. We also have good links with community and patient groups, which can be really valuable. So we might be able to help signpost you to places that you could identify people who would be interested in supporting your application. If we don't have links, we can always suggest where you might want to look as well. In a kind of pre-COVID world, we would often help facilitate meetings. Obviously, the sort of landscape has changed a little bit there, but there's certainly still scope for supporting online PPI sessions if required, and if you feel like that would be helpful to you. Importantly, we also have a funding pot, so we are able to help with funding for public involvement work prior to an application going in, just to ensure that you're able to remunerate your public involvement representatives before your project's actually funded. So the second question that you'll be asked in the second stage of the application process is, please describe the ways in which patients and the public will be actively involved in the proposed research, including any training and support provided. So at this point, you'll be looking to sort of clearly explain your plans for public involvement going forward. It's a really good time for you to refer back to the research cycle that I spoke about earlier and have a think about the ways in which your project, your individual project, will benefit from input from service users. You'll also need to think about how they'll be supported. So do you need to seek any specific training for them, or will you be able to provide that yourself? It will depend on their role usually. Will they perhaps have a specific member of the team who will be their key link and they'll work more closely with that individual? It may be that you have a more experienced public member who mentors a less experienced member. So, there's lots of different ways and lots of different models in which you could use to support your public members. ultimately you'll just need to kind of think about exactly how you want to do that and make sure you're able to describe that. In terms of the RDS and the support that we can help for this second question, so we can help you think through your plans for public involvement essentially, and help make sure that you have a really strong and meaningful plan to involve service users throughout the course of your study. We can also help you think about things like making sure you're adequately costing for the public involvement plans that you have, that you're thinking about all the costs and the funding that you might need to apply for to ensure that you're able to deliver on that work. There will be a third question, which is in rare cases where proposals do not involve patients in the public, clear justification must be provided. In this case, I would, if you think that this is applicable to you, I would strongly recommend seeking advice from an RDS before you go down this route. I think there's very few circumstances where the panel would accept a justification against public involvement. Personally, I've never actually come across an example. So I think it would be a good idea to have a conversation and just have some input from public involvement advisors in terms of ways that you may not have considered public involvement might contribute to your study. Just a kind of brief reflection on the current sort of environment with COVID-19 pandemic. Obviously, there's challenges kind of across the board, but there are, I think, some really unique challenges relating to how we kind of meaningfully and safely involve members of the public in our research. I think it's particularly important when we're thinking about perhaps vulnerable communities or individuals who may not have access to sort of technologies and things like that. One thing I always advise people is to kind of think about whether there's any community or not-for-profit groups who are sort of working in the population that you are, and they may already be doing some fantastic work to help involve and engage those communities and keep them in the loop, as it were. And there's a lot of learning to be done out there from those kind of groups. And you can always speak to somebody from the RDS to kind of to help you think through what you might do in order to ensure that you're still able to get meaningful input. There is a link here. There's a blog that we wrote as a national RDS PPI group with some kind of, I think, some quite helpful suggestions and also quite a few links to other resources that are available. So it might be worth having a look at that if you're struggling a bit. Okay, so I've just got a couple of minutes left, so I'm just going to talk really briefly about your plain English summary, which you'll also need to include within your application. Plain English summaries are often a sort of bit of the application that people kind of leave to the end and perhaps don't invest a huge amount of time in, but actually they're really, really important for lots of different reasons. Firstly, it's worth noting that on the panel there will be public members who will be kind of using the lay summary to get a kind of better understanding of the research, but also even those members of the panel who aren't lay and who are there for kind of their different specialities won't necessarily have an insight into your area. So the vast majority of people do tend to read the plain English summary first, just to kind of get an idea of what it is you're proposing. So in terms of kind of first impressions, it's really important to have a good summary that really clearly lays out a kind of a strong justification and a strong case for why you want to do the research that you're proposing. In terms of how you write a summary, I think the key thing to remember here is it's not a stripped back version of your scientific abstract. You should see it as a kind of standalone piece of writing that you develop from scratch. There is some structure guidance within the NIHR application, which is really, really useful. So follow those headings because they'll kind of lay out your justification and your plan really nicely, and they'll help you kind of structure that narrative in a way that is kind of convincing and kind of brings people along with you.